So it is my great honor tonight to introduce Naa Professor Edmund Delle, Paramount Chief of the Nandum Traditional Area and one of Ghana's most distinguished physicians and statesmen. Born in Nandum in the Upper West region, Prof. Delle earned his Doctor of Medicine and Surgery from the University of Padua in Italy, followed by postgraduate diplomas in tropical medicine from the Institute of Tropical Medicine in Antwerp and in skin and venereal diseases from Padua. After serving as resident medical officer and lecturer at the University of Padua, he returned home in 1974 to found the Rabito Clinic, named after his mentor, Prof. Rabito, which has since become a leading private medical institution in Ghana. Over his illustrious career, he has received numerous national and international honors, including induction into the American Biographical Institute Hall of Fame, the Marie Curie Award from the International Biographical Center, the Ghana Medical and Dental Council's Lifetime Achievement Award, and recognition as Health and Medical Services Entrepreneur of the Year. A fellow of the American Academy of Dermatology and the Ghana College of Physicians and Surgeons, Prof. Delle has been a founding member and leader in multiple professional societies, including the African Association of Dermatologists and the Ghana Society of Dermatologists. Beyond medicine, Prof. Delle co-founded the African Commission on Health and Human Rights Promoters, chaired numerous Catholic initiatives, and served as national chairman of the Convention People's Party. Currently, he is a professor of dermatology at the Accra College of Medicine and consultant dermatologist at Rabito Clinic, where he still sees patients and where his lifelong commitment to clinical excellence, education, and public service continues to inspire generations of health professionals. We're so pleased to have you, Prof. Delle. Tonight, he'll be talking about acne. Over to you.
Thank you for the fine introduction. We've been in dermatology for the past about 5 decades, and definitely, as you stay in a specialty, any specialty, you have your own way of considering certain important parts of a subject. And my love of dermatology has pushed me to an extent that even though I'm a paramount chief now and I should be at the traditional area sitting with my people, I love dermatology such that I still want to come round and then help the younger ones and let them know my interest in dermatology and encouraging the younger ones to do dermatology. It's sad to say that dermatology is considered as an orphan specialty, and I totally disagree with that assertion. We are only treated as a sub-specialty under internal medicine. Under internal medicine, I totally disagree with that. How can you call the largest organ of the body as an orphan? It is so because teaching dermatology for students, 6 lectures or just 20 or 30 lectures, how do you expect the students to appreciate the importance of dermatology? I'm so happy to talk about acne because my lectures always include what affects the majority of the people in Ghana or in the world in general. And I'm telling you that of all the facial dermatoses we know, acne is number 1. When I started Rabito Clinic in 1974, our then Minister of Health, I went to say hello to him, and I told him that, please, I would like to start a clinic for dermatology generally. Of course, being a diplomat in tropical medicine, of course, you cannot do dermatology alone. People will definitely come to you. Ghanaians and most people know that you are a doctor, so they will bring any case to you, whether it's a pregnant lady or, in my very case, very amusingly, I named my clinic after Rabito, my professor of dermatology in Padua, who took liking to me when I went to Italy in 1964. I had itching all over the body, maybe change of weather, the cold weather, I couldn't stand it. So I went to see Rabito, and Rabito said, okay. He gave me, I remember now, some antihistamines and just some creams to apply on the body. And after a week, I felt better. So I told him, and then he said, Edmond, now you see the importance of skin. You see how it can make you uncomfortable. So please, I encourage you to do dermatology when you decide on your specialty. And I said, yes, Professor, I'll definitely do it. And I owe it to him, to Professor Rabito, that I'm now a dermatologist. Yes. Now, why is dermatology important? Even though in Ghana, for instance, we have the Ghana Medical and Dental Council, medical, surgical, and dental, without dermatology, the largest organ of the body, and yet it is placed on, I oppose it strongly. And so that is why when I came to Ghana in 74, I wanted people to know that our skin, which covers the whole face, is our identity in society. And you know straight away, black, white, yellow, or whatever happens. And those of you who read, and I know a good number know that you talk about dermatology of color. That is to say that certain diseases in people of different colors, there are some distinctions. Because I remember when I was a student in Italy, and after teaching, you go, they will teach you the basic science of dermatology, erythema, papules, macules, and all those things there, which we have seen in white patients. And you come to Ghana, you look at a patient who's supposed to have an inflammatory disease. You also are going to see the redness, and you don't find it. It has a dark color. That is why I got, even before coming to Ghana, I took much interest in dermatology of the black skin. And my professor and I, who worked together, Professor Basse of blessed memory, decided that it was worthwhile now for us to have the dermatology of Black people as a specialty by itself. And of course, as I started again, my minister of health at that time said, oh, Dr. Delle, you are coming to Ghana and you say you want to set up a skin clinic. Let me tell you that Ghanaians are not interested in their skins, in their skins. So I advise you to add general medicine to your clinic. And not only that, also add laboratory, since you have done tropical medicine. And so that will guide you a bit. Of course, to my surprise, the first patient I had in Rabito Clinic in 1974 was what? Rabbits. Somebody with a box of rabbits say, oh, Rabito Clinic. For the first time in Ghana, we have rabbits clinic. And I said, no, it's Rabito and not rabbits. So I'm not an expert in that. And of course, the next thing was, since the minister said I should ask general medicine. So of course I said, Rabito Clinic, skin and general diseases. But still trying my point to make sure that dermatology takes an important stage in my life history. So we started. And to my surprise, after less than 3-4 years in Ghana, I realized that, contrary to what the minister told me, Ghanaians are interested in their skin. And in my opinion, your skin, and particularly your face, is your passport to society. It's your passport to society. just see the subject we are going to discuss, acne, or for the ordinary people, they call it pimples. So I always tell my listeners that, look, a pimple on somebody's face is more important to that person than war in Afghanistan, because people are so conscious of their skin, of their face in particular. A little pimple on the face, they try to see a doctor or a dermatologist. So to my surprise, over 50 years in Ghana, the leading skin disease is acne, or the ordinary, people call it pimples. And then I was particular about what I was taught in school about acne. You know, it's a polymorphous disease with your papules, your macules, and all that. And so, of course, diligently, I always look around for this. And if you look around, the black people, you may not see that redness in a white skin. And more importantly, for a novice in black dermatology, what worries the patient is not so much the papules and the nodules that you see, but what worries them are the macules, the marks, the dark spots on the black skin. This black skin is a big problem for us dermatologists in Africa. After you've done all that you can with the patient will come back to you and tell you that, look, you have done well, you have removed all my pimples, but I have these dark spots all over my skin. What should I do? And so that is the point. Like every dermatologist, as you grow in the profession, you have your particular points. So dermatology, as we were taught in university, and in most of the textbooks that I read and the research I did before coming to Ghana, they said things like acne are very rare in black people. And I said, what? Then I come to Ghana, and it is the leading skin disease we have in Rabito. We are dotted all over the country. Bolgatanga, Tamale, Kumasi, Nandom, Girapa, all those, we were dotted all over the country. And the story was always the same. People with pimples on their face, what we call the acne, in different forms. And the idea of, is it more common in girls or is it more common in men? I definitely confirm from my experience that, of course, definitely, the men, the women are the first people to come, but the adults too, even the young people also come there. When they will not come there with just minor pimples, but they will come to you particularly when the stage is such that either is the so-called nodulocystic acne, and then when they then find out that you have the disfigurement, and this is one of the things about acne, that the patients notice that their face is no longer the face they had. That mark with the nodules, the papules, and this one, they get very much worried and they come to me. So I had a fine way of talking to my patients. That when they come, I look at them, and most of the patients I've seen so far, the majority are females. But then you also have the males coming, the young ones, of course. We know that juvenile acne too is very common in Ghana and in other parts of Africa. So people come in their numbers. And every year since Rabito started in 1974, the greatest number of patients we know are patients who complain about acne. Since the people listening are dermatologists or people who are this one, and we don't need to spend a lot of time on the various types of acne. I always tell my students, be interested in the common diseases that you have. And I give them one thing. When you look at a patient, you quickly look around and say, is the disease common? The second thing, and patients will always ask you, is it contagious? Is it contagious? Because even people with pimples, are not thinking only of themselves, but are thinking of the family around them. Is it a contagious disease? Am I going to contaminate my partner or my children? And of course, the most important question they ask you, doctor, is acne curable at all? And I'm so sad to say that even some doctors, I'm sorry to say that, tell the patient that this is a disease of the youth. And as you grow, acne will go away. And this is one of those things that has affected the patients a lot. Those people who are not dermatologists or have not been trained in dermatology just say it's nothing. And later on, only to find these patients coming to us with comedones, white comedones, and this one, and very, very thick puffles and macros and nodular cystic acne. And that is then the time that they cry on us as dermatologists. So generally, they will not come until it is the severe types that we see. Most of the simple ones, you don't see them at all because they treat them at home with local medications and this one. So I have asked my students and those who are working with me, from the experience we have, we must give importance to acne. Well, our experience shows that, as is told all over the world, more women come to the clinic than more females come than males. But the males too are sometimes lazy. They come late and they come with the severe ones. Even you go and see a family, maybe 2, 3 of the girls have acne. The brother too has it, but the brother does not want. And by the time the brother comes, you have the nodulocystic type of acne. And then, of course, acne is important in a sense that I always tell my patients, don't get up in the morning and be looking at your mirror. They love it. They want to see the situation of the face. And of course, most of you know that one of the things that makes it difficult to treat skin patients is that as soon as they see the papules and the nodules and they try to press. Their hope is that as they press the pustules out of the skin, they feel more comfortable. And I ask my patients, I beg you, don't press this because it can damage the skin, it can create a scar, and that will make your skin even worse. So I think that we should give much importance to the skin. One, because of the psychological effect it has on the woman or on the boy. Because these children, these people who have acne, they tend to hide, shy away from society. So the psychological point of it is very important. That is why I'm happy to say that for the past 2 years, Rabito Clinic, we have been able to get the assistance of clinical uh, psychologists to assist the ones who really feel very bad with the acne and are hiding and we're treating them. Another thing I've encouraged and I've not totally succeeded is to get these acne patients to come to me at least once in a month for us to chat about their experiences in acne, you see. And I've not succeeded, but gradually I'm going to continue with them so that they come and give us their stories about how they think they got acne and why is it that they don't want to go to the clinic? They just follow the idea that no, it will, as you grow, the pimples will go away. They will fly away, which is not the case. So what would I say? What are the common ones? You will see that the common ones are those, they arrive at you when the face is disfigured. Your nodules, your pustules, your scars, and that's why I call it a polymorphous disease. If you want to learn dermatology, look at somebody with acne. You have the macules, you have the papules, you have the pustules, then the post, once you have scars, and then especially the hyperpigmentation in Black ladies and men who have acne. So it is is well known, and I wouldn't waste my time telling you every day, if you are a dermatologist or even a common physician. Most of the times you see this. So I'll just say that it is a common disease, and like all common diseases, there are so many of them in all over Africa and the world too. But they, as he said, the harvest is plenty, but the laborers are few. So Africans, we have a lot of skin diseases, and acne is one of them. But the dermatologists are very few. Ghana, when I arrived in 72, 74, we were just 3 dermatologists. The senior one of Blessed North Mori is gone. Jenny too in ability as well has left us. But encouraging the younger ones to do dermatology, we have been able to get about 20 for a country of how many million? Over 30, 31 million. Nigeria has the same problem too, a huge country like that. And they don't even have 300 consultant dermatologists. And this is sad. So talking like that, lectures like that will assist us to encourage people to come to our clinics and that we can help them. So this is what happens. Why they will definitely ask you, what do is about acne? Of course, we know quite well that there are hormonal influences because when you start getting young, your breasts are showing and you begin to have your pubic hair, and that is the time you see the acne coming in its numerous forms. And as I say, we always see them in the stages where you don't even need to examine. You see it classically, the things they tell you with the pustules, with the cysts, with the scars. And so they come there already, and they will not come to you directly. By that time, they have tried a lot of local medications. They only come to you when they have failed to get their results. And of course, we can't forget that in Ghana, like in some most of African countries, there are our friends, the herbalists, who will go and tell them. And of course, some of them will give them things that is a spiritual disease. You got it from this. And it's still going on, even in Ghana, where we think people are. But they will still come and tell us that they think it's a spiritual disease. No, it is not. It's one of the diseases that we have studied for years, and we know that it's caused by hormonal influence. But in Africa, the part of it that has actually encouraged me and emphasized is that the cosmetic aspect of it. Because some of these our patients apply a lot of these oily creams, especially those containing cocoa butter, clear essence, and so forth. So they come to us already. You know that your face is oily, and you go and add oil again to it. So definitely. And of course, they will come. Our first question is that they will ask you, what is the cause of it? You try to explain, but of course, patients, you can't go into the details. It is because of blocking of the hyper functioning of sebaceous glands, and then your pilosebaceous. You have to explain to them in a simple language that they will understand. And I normally have pictures there to show them how the sebaceous gland is, and then your how it comes, goes through the follicle, and then if when the follicle is blocked, then you talk about the white comedones and the black comedones. Of course, some dermatology or most think that is pathognomonic. That means when you see the comedones, they will tell you that, but it is not easy to identify them because when the patients come, they have already put a lot of, but in a few cases, you are able to, and we are lucky that I normally carry with me a simple tool, that is the comedone extractor. You press it on it, and then you see it coming out like cheese, like thing, and you know that these are comedones. And then I always have a picture in my room to explain in simple language why you have acne and what we should happen. But patients sometimes get worried about the triggers of acne. What triggers acne? Of course, some authorities still believe that food has nothing to do with acne. Some argue that no, they emphasize the hormonal ones. But in my experience in Ghana, I tell the patients, what is it which triggers it? And then there are sometimes they will tell you, yes, I notice it myself. When I eat a lot of groundnuts, the pimples come out more. Or when I take seafoods, because those living by the seas are shrimps, crabs, and so forth. But it is not only the food as such. Some of these things are made into powder form and they put it in the soup and you have it. But my experience is that most of them tell me about the groundnuts, the nuts, and they tell me about the milk and milk products. Because cow milk and those things, they really tell us, but we must understand that these are young people, 17 to 20, 25 years. So when you want to tell them that don't eat this, don't eat that, I find it difficult to stop them. So I always advise them that try and have a food diary. When you take that food, say like the nuts, and you find out, of course, you try as much as possible and stop it. And of course, when you take things like fish or and you find the fried ones with the cheese, then you stop. But it is dangerous to tell them, stop all this. What do they eat? Some of them literally come and tell us, but they say, I shouldn't take milk, I shouldn't take nuts, I shouldn't take eggs, I shouldn't take, then what do I eat? So that is why in a place like Africa, Ghana in particular, if you deprive them of this. So, but don't forget that a good number of the people too are sophisticated. So they will come and tell me, then let me find out whether the triggers to this. And then if there is a way you can examine. So of course, the demand of the patient, sometimes we do these common tests on milk and milk product, on nuts, sometimes eggs, sometimes wheat, and more importantly, the seafoods. And then occasionally, quite a number of cases, one of the one which gives us the problem are the milk and milk products. And of course, if they are young ladies or young people who are growing adolescent acne, and then you tell them not to take these things, it affects them. So I found a solution to this that fortunately in Ghana, we have these products which are what we call non-dairy products. And they are done in Ghana too. So I tell them, okay, if you don't stop, go and take the milk which is produced from plants instead of from animals. And they, yes.
All right.
What are they saying? Should we go on or we wait for?
Yes, no, please go on. It was just people, make sure that everyone is muted when you join the call.
Yes.
Go on.
Yes. So my experience, practical experience is that the triggers, foods are important. And not only that, one of the things too, I clearly tell them, and we blame the patients, is stress and worry. All of us know as clinicians that if there are students from the university or from even the, when it's time for exams, you find they come up and these pimples pop up in their numbers. So I jokingly tell them, you wait, as soon as your exams are over and you pass, these pimples will go. And so, of course, they understand. And okay, then I'll ask them in the family, are there some people who have had it? And most of the times they will say yes. Another will say this, but that it goes away without any treatment. Of course, it is possible. But I always encourage my patients that don't wait till the last minute when the thing is worse than you can. Try and come as early as possible. Then we find it easier to teach you. So I found that one too is very important. Of course, the ladies, when they come to me, They are worried. They want to find out whether it is their menstrual period, because some of them will, the flare-ups are during their menstrual period, premenstrual period on this one. And so one of the things I've noticed in this year is that some of these patients and a good number of the ladies are asked them to go and do a pelvic scan. Why do I do that? I've noticed that a large number of my patients who complain of acne, at least in Ghana, with my experience, they have these polycystic ovaries. And so a number of them have it. So to some extent, I've noticed that when we get this one, I work with my gynecologist to see how we can help them. And in my experience, I'm a staunch Catholic, so I'm not allowed to prescribe pills, but I try to tell the bishop that no, I'm doing this because I want to see how managing the hormones, the patient can be all right. And I have experienced that, particularly those who are in the college and those who don't have enough money to pay for the expensive creams that we sell to them. I sometimes use that one, but I say it, I'm using the hormonal aspect of it and not to this one. And I can tell you that sometimes if you give them, some of them, particularly the young girls, have this what we call hirsutism. You see, they grow beard. And that is sometimes a sign for you. Go and do something, test the hormones, and you see that they have, tend to have more male hormones than female hormones, and then we try to assist them to assist them during the treatment. But of course, people are not interested in theories telling them it's caused by this, and they are interested in care. So the first question they will ask you that, will my acne clear? They want a clear statement. Is it clear? Yes, you have to encourage them, but you have to tell them that you need time. And because a lot of our cosmetics in the market are all oily, particularly these oils, they apply oil to oil does not help. So I try to encourage them. And Ravito Clinic, I'm happy to say that we have been able to make products for them to suit them, and they use them, which are water-based instead of oil-based. And they're happy about it, using even our local ingredients. So they're happy about it. But those which are strictly this one, and with the heat in our countries, the sweat and all that, it becomes very difficult for us. Now, because of time, what is the treatment for acne? Talking about hormones, as I said, some people, when you control the hormonal aspect of it, the people are okay. But most of the time, we have to intervene. And let's start first with the topical treatment, because be careful of the oily products on the. I tell them, and I give them products. And I give them products which are water-based and tell them, don't use till we are fine, then we do that. So if when you see people talk about mild acne, medium acne, and then severe acne, I know of it, but I'm more interested in the psychological aspect of the patient. Because some patients, even a small pimple on the face, they are easily taken out. And what we have, one of the problems we have when we are treating acne is, and I call it, it is not something that I always explain to my patient. You know that because of the system, and I show them a picture, you see, it's blocked there, and then the sebaceous glands enlarge and break and enter the dermis itself where you have the true skin. And then it creates what I call a foreign body. And that foreign body is inside, it's an irritant. And so the body, if you are to treat acne, you try to get this foreign body out of the skin. And that is what we call surfacing of the lesions. And this is where we have a problem, because whatever treatment you give to the patient, This surfacing of the lesion is very, very common. They flare up. And then, of course, they want to throw away the treatment because they say, oh, I went to Prof and I thought that my acne was going to be better, but it is worse. So you have to be explain to the patient, take your time when you are applying the creams, you don't need like the retinoids, which we use a lot. We now all use it. Retinoids. They are effective, but they give rise to this surfacing of the lesions, more pimples coming. And so the patient says, I've come with small pimples, and now after going to the clinic, more pimples. So you have to explain to them. It's like a foreign body, and you are throwing it out. Then they understand. And as for the illiterates, they have a better understanding of it than we, the literates. And we must train them how to apply the creams because they think the more creams they apply, the more they will heal. So I tell them to take their time, just lightly on the thing, very, very lightly. And also because of our sun, the sun heals, but sun too can make it worse. So I always tell them to be very, very careful about the sun. So I advise them to use sun protectors, those which are made up of water-based sun protectors, so that they don't have to use the oily-based one. And I'm happy to say that throughout the years, I've got just 3 simple ways of treating acne, depending upon where you are. Because we go into the villages, some of our clinics are exposed in the villages, and you can't go and give them cream that they cannot afford to do. And that is why I still tell my students that I still believe in the use of the galenic products. Galeno, after the first Roman doctor, Galeno. That means things like sulfur, of course, the scent also for you do it like that, and salicylic acid. Yes, the percentage Rabito, we prepared some already small percentages, 1 to 2%, and they apply, take off the peeling, and then with the antibiotic creams that we have in the market. But more importantly, you have to advise them not to be pressing the pustules or the nodules, but they enjoy doing it. So what I tell them, I beg you don't. And in fact, there are patients who come to tell me that they even call their parents or brothers to help them to press. And when the pus comes out, they are so happy. By in doing that, you create scars. And then you come back after we have treated you with your scars, and we have to work on that too. So I think treatment of acne is quite simple, depending upon where you are. Some of the patients can afford. The first line of treatment we have here is antibiotics, tetracycline. Now, we don't use it much. I don't know why it's out of the market, but we use doxycycline. And of course, those of you who know, so far, the one which works best is minocycline, but minocycline happens to be quite expensive. And since the patients have to do this one for a long period of time, and with the tetracyclines, I always advise my patient, be careful of the sun, and then be careful of antacids, and then take it as much as possible, some 30 minutes before you eat. Some of them say it's better that way for better absorption of this, others say, and then to stop taking milk products. These little hints assist them, and then I get some good results. But of course, currently, for the past 35 years, 30 to 40 years, I'm relying a lot on the isotretinoin. In fact, fortunately in Accra, a good number of the patients in Kumasi, they are educated and they can pay. So for the past 35 to 40 years, I try as much as possible to introduce isotretinoin. Of course, I worked with the Roche people some 40 years ago, and we had the isotretinoin from Roche. And then what I do is that I tell the patient, I check your weight, I do your liver function test and your renal function test. And more importantly, especially for the women, I want to be sure that you are not pregnant. Because those of you who know about isotretinoin, if the patient is pregnant and takes it, it may give rise to an unborn baby or babies with dysphoria is clear and is dangerous. So I always insist on my patient doing a pregnancy test at the place so that I'm sure she doesn't have it. And of course, I look at the liver and look at the kidney because if the person has a liver problem, I never give it out. And of course, there is a debate about the dosages. Some prefer the minimum dose of 0.5 milligrams per kilo weight to be able to clear it. And of course, in some countries in Europe, they talk about 4 times a day. I don't find it realistic. I've always tried to tell my patient, take in the morning and take in the evening. Somebody is at work, how can the person do it 4 times a day? And I found that very useful and it works. So I try to tell them to take it. Yes, but you have the Roche product. The Roche product is very expensive. So we have got one from Malaysia, which is isotretinoin 2, but is called Acne. So I use that one too. And I'm happy to say that normally between 4 to 6 months, most of the cases of acne we see at Rabito Clinic are cleared. And after that, of course, you have the cosmetic. Hello? So,
Apologies, Prof. Just to say, I think we should try to wrap up in about 2 minutes so that we can open it up for questions.
okay, please. So I have found that one very, very useful in Ghana. And I'm happy to say that my patients are happy with it because you don't have to swallow so many antibiotics for 2, 3 years. In fact, they will go and come. So I found it safe. If you check the liver and check the kidney and they are fine. My experience shows that 1 milligram per kilo weight is quite okay. There are some dermatologists who scale it up. I prefer to use that minimum dose, and I've got very good results for the past 35 years. And we have pictures to show them that if you do that, of course, the side effect is cheilitis, dryness of the mouth, and sometimes the body. So I tell them to drink a lot of water. And then, of course, to use moisturizers. And of course, to use so that because of the sun, it darkens the face. And so the patients are not happy. But we are happy to say now that Rabito has a clinical psychologist to help them. And we also have a cosmetic center so that when you have this hyperpigmentation, which our patients do like, we are able to clear it for you using peelings so on the whole, I can say that our success rate has been very good, 80 to 90%, sometimes more. Once you are able to convince the patient that this is what is happening, and you explain that, I always say it in a joke, if you want to be cured, suffer today. Make sure that you don't run away because of the side effects. I explain it to them, and then I tell them that don't be in a rush. One secret I have found about the cystic acne is that when I go to the rural areas and you want to do infiltration with triamcinolone in a rural undertaking, it's expensive, and to inject it, well, you will succeed in clearing the nodules, but there will be a part there which is a leukoderma. And then they will be very sad about it because instead of the dark color they will have a fair, and it's difficult to convince them that the color will come back to the normal. So I found a little way of doing it, and it has worked marvelously. Instead of rather doing the infiltrations, unless you take them of it, But I let them apply Vaseline around the nodule and apply the Demovate there once, two, or within 2 weeks, it's cleared instead of doing the infiltration. And it has worked well for my patients, those who cannot afford to pay this one. And of course, you also have them with the antibacterial soaps. And then you ask them to whether they have dandruff. In my experience, dandruff, a good number of them too have seborrheic eczema at the same time. So I try to get some shampoos for them, and it helps me. But I never forget, before they go, I give them a piece of paper so that they can read and then try to observe some of the advice I give to them. So I tell them, leave all your cosmetics which are too oily, and I'll recommend the water-based ones. And Rabito Clinic, we have prepared some for them so that it doesn't, for instance, our butter, shea butter, is not bad, but it's, so we have prepared some for them, which works well, and they're happy about it. It doesn't contain any of these creams which tend to bleach the skin. Okay, thank you.
All right, that was excellent. Thank you so much, Prof. Delle. It was a great overview of all kinds of aspects of acne presentation, diagnosis, and management. I wanted to leave a little bit of time for questions, and we already have one question in the chat. And so why don't I'll just read it to you. Actually, there's two questions in the chat. The first, and they're both from Dr. Agekam. The first one is, does personal hygiene play a role in acne development?
Pardon?
Yeah. Now, Professor Delle.
Did you hear me?
Yes.
My colleague is an American.
Yeah, sorry, I'll mute this.
Yes, let me listen. His question. Can I
So the
hear
question-
his question? Yes.
About personal hygiene, does it play a role in the development of acne?
Definitely, even in most of the skin diseases we have. In fact, a friend of mine, a friend colleague said that if we had good soap for them and good water, a lot of these diseases will be cleared without their coming to us. And in the clinic, I tell them, we normally advise them to use a good soap and then give them a moisturizing cream, and that alone. So it's important. But you know what is happening in Ghana and in some parts of this change of climate, you know, these and the waters now in our, you must have heard of Galamsey in Ghana. Our waters are now polluted. And so if you watch this type of water on your face, definitely it has a role to play. In fact, a professor friend of mine in a joke said that if Africa had good hygienic excellence, a lot of our skin problems will be resolved. But it's not an easy order, because there are some people who don't even get enough clean water to drink. How much more to wash down? So I agree with you, and particularly, I'm happy to say that recently I got a patient from Norway. And this patient was telling me that since he arrived, she arrived in Ghana, the acne has worsened. And then he said, is the climate, the sweating and so forth, and that not washing down well. They have to wash down well. And then sometimes to get even clean water is a problem. So I agree that he has a role to play. No doubt, hygiene.
All right.
Thank you.
Sure. Yeah. We only have 5 minutes left, and there's another question in the chat. And I just want to remind everybody, we'll do the second question. And then if other people have questions, you can write it in the chat. You can write it in the Q&A section, or you can just raise your hand or unmute yourself and go ahead and ask it yourself. The second question in the Q&A is, can you please talk briefly about fungal acne and a simple way to manage that?
About fungal what?
Fungal acne. Acne caused by fungus.
No, I think we know of acne, but fungal acne. That's why I was telling you that most of these patients have seborrheic eczema. And then they have dandruff. In fact, in my thing, the first thing I try to do is to clear, one of the things I do is to clear the fungus. They have dandruff, so I use shampoos to clear that before that. But I am not aware of a fungus creating acne. A fungus, you can have what we call an, an eczema, mycotic eczema from fungus, but creating purely acne is not. What could happen is that these patients can, fungal infections, they give you, the tendency is to scratch the face. And in fact, we have been doing research. There is a mite on the face called Demodex mite, and it loves the oiliness of the face. So it's there. So if those things are there, if you don't clear them, you may think they are causing the acne, but I'm not aware of acne being caused by fungus. On the contrary, what happens is that people with acne, because they scratch and do things, you have contamination, and that what we say secondary infection due to the acne. So you can have fungal infections, you can have bacterial infections in addition to the acne by itself. So as for cleanliness, I always tell my people, it's next to godliness. So I do agree that
Yes.
it is, yes.
Great. Those are the two questions that were posted in the Q&A. I will open it up for any other questions. We have 3 minutes left. And people can post, or they can just go ahead and unmute yourself or raise your hand. Go ahead, Abu Kari.
Yes, good evening, and then good evening to you, Prof. This is Dr. Abarika. So I think that in your presentation, in terms of in the treatment of acne, you made mention about the use of tetracycline and then other antifungal agents, especially the oral medications, and then how, people always need to be careful when they are treating patients with the oral option. So I just want you to throw more light on the significance of determining the status of the liver and the kidney in terms of determining the liver function and then the kidney function in acne treatment, such that that will encourage a lot of our doctors to do more investigation into some of these organs when they are administering oral treatments. Thank you.
That's a good question. He knows that I'm very particular. I don't start treatment at all on not only acne, on any disease without checking, because most of the treatments on skin disease, and this is why our other colleagues tease us, that dermatologists we don't kill, but we don't cure. We are always seeing the same patients, but we both, if some skin diseases kill, and some disease too, we cure them. It is just that, you see, we don't control the environment. You treat the patient goes back in the same environment, have this one. So I think that it has a role to play. So we must always check. For instance, if you don't check and you start using these retinoids on the patient and something happens to the liver or the kidney, you'll be blamed. And because they are not short-term treatments, this is why I'm not too happy with the antibiotics. If there were things you give 6 months, the patient is gone. But I'm telling you, experience shows that sometimes you have to do it over and over again. Some even have to go and do culture tests for this. And of course, I don't use the antibiotics because you have antibiotics like clindamycin that some of my colleagues use. It gives you trouble with your intestine. And then it can lead into worse conditions. So let's be very careful about using and abusing antibiotics. Thank you.
Great. Okay, well, we're at time, but we have one more question. So let's just take this last question. We hope you can all hang out for a few more minutes. Go ahead, Dr. Lewis.
Yeah, good evening, Prof.
Yes.
Really interesting that for the past almost 1 hour, you have spoken to us extempore. You belong to the old guard. I'm sure many of us coming into this webinar were expecting to see slides and all that, but to their surprise, you spoke extempore. Thank you very much for agreeing to do the first lecture in this series. I suffered from acne a lot growing up, and it had a lot of psychological impact on me. How do you deal with issues like that? Because as a gynecologist, I get to see some women in pregnancy, and it's just so terrible. They can't look up to anybody because their face has completely changed. How do you deal with the psychological impact of acne on the young ones and even pregnant women? Thank you.
Thank you. In fact, I'm happy that you have asked this question. That is why, Rabito, for the past 2 years, we have employed clinical psychologists to talk to these people because they're very anxious and depressed. And I do a very simple test. Those of you who have been coming to my lecture, I just let the patient stretch his or her arms. And then you find that from the eyelids, palpitations there, up and down. And then you see the lines even there, what we call Dennis Morgan signs. That already shows me that it is not only that this patient might have some allergies. So it is important that we pay attention because it is not easy at all to treat patients with acne. And they will tell you that, I've been coming to the clinic for the past 6 months or 1 year, and it's the same. It goes and it comes. It goes and it comes. So some dermatologists excuse themselves and say, acne can be managed, not cured. But I can tell you confidently, with years of experience, if you are patient and the patient is, there is no type of acne that you cannot cure. You finish it completely. Of course, with the assistance of your gynecologist, I don't work alone. When I have problems, I call my gynecologist and ask for his opinion on this thing. And so this is where this unity of opinions, I consult a lot with my gynecologist in some cases to advise me and work together. To the extent that we now have a book written by one of the gynecologic dermatology. Because I tell my students that we dermatologists, we don't only deal with the skin, with the nails, and with this thing, but we also deal with what? With the mucous membrane. And mucous membranes are everywhere, inside your mouth, your lips, and to the genital area. So, but I am not of the opinion that we should call dermatology dermatovenerology because of the stigma. I tell my students, I prefer saying dermatology, and that's all. You find in Britain dermatology, in the US, dermatology, not dermatovenerology, because as soon as you come to the clinic, people will quickly say, this, you have bambas or any of these things there. So I think we can get the assistance of some colleagues too. For instance, when I have a problem, I contact my endocrinologist in some cases. And of course, on these cases, I go to the extent of even checking the sugar level. You may be dealing with somebody with acne and you think that acne is that one, and you find out the person has a problem with the sugar. So when you are able to get assistance to control the issue, your acne treatment will be better than before. Thank you.
All right. Well, we're over time. I want to just take a moment to thank you and express our gratitude for starting us off on this CarePoint Symposium journey in such a wonderful way. And I think it's sort of appropriate that we ended out talking about sort of interprofessional collaboration, because that's sort of what we're doing here today, is bringing together health professionals across different health systems across different countries to learn from each other. And it's so important that we do that. Thank you all for joining us this evening. Remember that we will be doing this every month, the first Thursday of every month going forward. And I really hope that you will all join us in December on Thursday, December 4th, to hear from Dr. Okuchi Owoichi from Lilly, who's going to be talking to us about endometriosis. Prof, thank you again. We really appreciated it.
Fantastic. I'm happy a gynecologist is coming to talk to us.
Yes,
I'm really happy.
exactly.
Thank you. God bless. Thank you.
Thank you. Have a good night, everyone.
And good night. Thank you.
Thank you, Eliza.
Thank you.
All right. Thank you, Prof.
Thank you. What do I need notes for? Everything is there. Going through the number of notes in the workshop, you have use notes. I can read them at all. It took me 5 years. I talk from the head. Thank you. You're extremely useful. So, whose is that? Is that yours?
This is for the office.
For the office. They are giving me one.
Yes, yesterday.
Yes. And they brought me a second-hand one. I protested the second. Now I want also to know how to do things myself.
Would find a day and come and log in your email.
Okay.
So that this is from your email.
Fine.
Yes. So when there's, so you can mute it. When there's, you can close it. When there's a new meeting, this one we just use your